Welcome to the Equine Vet Connect podcast. I'm your host, Dan Carter. I'm a veterinarian and a farrier. The goal of this podcast is to educate horse people, break things down, bust myths, and keep it real. Speaking of breaking things down, here's my legal disclaimer to keep my attorney and insurance company happy. While I am a vet, I may not be your vet. Contact them before trying anything you hear on this podcast. Remember, just because you watched it on YouTube or heard it on a podcast does not mean you can do it. Please use common sense.
All right. Woo! Let's do it. See, you have all the like numbers things, like how many cases, and I'm just like,
I like statistics.
see, I don't. That's what I'm saying.
I like numbers. I like facts.
See, but I can't remember numbers.
Fact check my podcast.
Yeah.
This is a factual podcast.
True. Okay. Do we want to bring up the fact? Well, I guess obviously Dan's not here. It doesn't matter. Okay. All right. Good morning. Welcome back to the Equine Vet Connect podcast. I will be your host today. I'm Dr. Caitlyn McCaulley, and I have Dr. Caroline Brown with me this morning. So we are going to get into a topic that is always very important, but I feel like recently has popped up a little bit in the horse world again, as it should. So we're going to talk about equine infectious anemia today, or EIA. There was recently an outbreak in Texas, Oklahoma, and Colorado with several horses there. So it's kind of been circulating around on social media and in all the equine forums and things. So figured we would touch on it today, kind of explain, what it is, how we test for it, how we diagnose it, all those things. And just give everybody some more information.
Because I think what a lot of people don't know is that this is what your Coggins test is testing for.
Yep.
And it's something that, if you're planning on going anywhere with your horse, you need to have a Coggins. And
even if you're not planning to go anywhere, you are supposed to get a Coggins test done on every horse on the property every single year. So we'll talk about why that is and why we're so annoying about it and why the state is so annoying about it because it is really important.
It is, yes. So equine infectious anemia, this is endemic all over the world. It's been in every country. There's only 2 countries actually that are saying that they are completely free of it, and it's Iceland and Japan.
Yeah.
So islands,
exactly.
but it's present all over the world, and it's been found in every single state. The most recent kind of comprehensive data that they have is from 2023. There were 61 positive cases in the United States.
Yeah.
So and they kind of tend to pop up in clusters. And we'll talk a little bit about what happens when you find a positive case.
Yep.
And so, usually you find one and they're related to others.
And that makes sense with how it spreads and how it's transmitted. So we'll get into all of that. But yeah, it's definitely found around the world. It's spread mostly by biting insects. So like biting flies, but also contaminated equipment. But all equids are affected. So horses and ponies, as well as mules and donkeys, even though mules and donkeys tend to be less clinically affected than the horses do.
And zebras.
Zebras. But yeah, it's definitely everywhere, but it's really common in the really hot and humid countries and areas of the country where there are a lot of flies and there are a lot of transmission that way. But yeah, it's definitely everywhere.
And per that 2023 data, they looked at all those cases and they found the most common population was quarter horse racehorses. So horses that were actively racing and horses that had previously had a career in quarter horse racehorses. And so, that is kind of our kind of key population. It doesn't mean that that's the only ones, but it is something that, just as again, we kind of talk about the spread of it and, how we're going to prevent the spread. That is kind of your main thing is in a lot of these, quarter horse racetracks, there is a lot of iatrogenic transmission, which is not from insects, but from, human error. So sharing needles, sharing, IV fluid lines, tattooing equipment, they've even said that they think that, if you use a lip chain on a horse and you get any blood on it, it could theoretically transfer from that. So, and I think you said you saw something, this virus was a kind of weird
It does.
ability to survive.
It does. So the equine infectious anemia, it's caused by a virus. It's a lentivirus or an RNA virus. But it's typically readily inactivated by like bleach or alcohol or several of those compounds. But it can live up to 96 hours on a needle, which is a really long time.
That's a really long time.
And especially, if you never should reuse a needle or anything like that. But if you're going, if you're doing a dental on a horse and you're going horse to horse and you get a little bit of blood contamination, and then, we're not waiting 96 hours to go to the next horse for a dental or for, if you are reusing a needle, which again, you should not. You're probably going to stick one and then stick the next one. And so that virus, if you pick it up on that first stick, it's there and readily available and you're transferring it to the next horse. So, yeah, that was very interesting. 96 hours is a really long time
for this type of virus, especially.
Yeah. So it is, like we said, it's a virus. So it has to get into the host, which is the horse or the equid or, whatever species we want to talk about here. But it has to get in and then it has to replicate. So the virus has to replicate in the cell to reach a certain viral load before the horse sees or shows clinical signs. And they've done studies, and so the more virus or the more viral load that's present, the worse the disease is in horses. And so it really depends on each horse and what type of, like, how virulent that viral strain is, or how infective that viral strain is. And so this leads into, there's a super wide range of what this disease can look like or present like. And so it makes it really hard to diagnose it without a test like the Coggins test.
And it's actually been said that you cannot diagnose this disease just based on clinical signs alone. You have to have a test because the signs are so vague.
Yeah.
There's so many things that, we see that can cause extremely similar signs to this.
Yeah, absolutely. There's a whole list. And, it's, when we get into it, we'll kind of go over everything, and it really is hard to diagnose just by the signs. You see an outbreak and it's not in our area, but as I was reading through, I was like, oh my gosh, I'm thinking about every horse that I've seen, and I'm like, well, these clinical signs are here, but it wasn't that, but it could be, like they're signs that we see all the time for other things. So,
absolutely. So let's kind of dive into like how this virus works. Get into the science of it.
Yep. So the virus gets into the horse, whether it is on mouth parts of a biting insect or whether it's on a needle, whether it's on mostly blood is the way that this is transmitted, but they say any bodily fluid can be a transmission factor, especially if there's any blood contamination in any of that. So it gets into the horse, and then it gets into a cell called a macrophage, which is part of the immune system. It changes the gene expression on the host cells, which then makes them pump out all these pro-inflammatory cytokines. The most important one in this one is tumor necrosis factor alpha. That is going to turn on what we call the arachidonic acid pathway, which leads to prostaglandins and then fever. So that's where you get your fever in this virus. And then the cytokines can also cause what we call thrombocytopenia or low platelet counts. And then they can also inhibit production of red blood cells, which is where the anemia part comes in. So that's kind of how it works. The platelets that are circulating around are also going to have a lot of bound antibodies to them, which kind of flags them to the immune system, and then the immune system destroys them. So that's where you get more destruction of platelets and more thrombocytopenia. So, but yeah, that's kind of
the gist of it.
Yeah.
And there's different phases of this too. So your first phase is going to last usually like 1 to 3 days, but there's an incubation period of this for up to 45 days.
It's really long
after exposure, which is kind of crazy. And they've even said too that they can't always detect it on a blood test. So if a horse got infected, today, and then we test them tomorrow, most likely they're not going to show a positive result. And again, it is really variable with how much of the virus that they got from wherever their infection was.
And also the test relies on the host's immune system to make antibodies. What we're detecting is antibodies. So
correct.
if they don't make enough antibodies for us to detect, we can have that period of 10 to 14 days where we might not get a positive if they are positive.
In this first kind of initial phase, which is, it's your fever, it's your lethargy. There's some evidence of some thrombocytosis in this as well if you do run blood work.
Yeah.
But it can be so minor that it's just easily missed.
Yeah.
It's, horses are notorious for being extremely stoic and if you have a horse that has a very low viral load present and they're just one of these horses that, kind of coast through life and isn't showing signs, you could totally miss this phase.
Yeah, absolutely could miss it. But after that acute 1 to 3 days, typically there's then a prolonged period of typically up to a year. These horses can do this where they have this cyclic presentation of, again, fever, depression, lethargy, things like that. And they can have increased heart rate and respiratory rate, anemia. They can have jaundice or yellowing of the mucous membranes. They can have little hemorrhages on their gums, which we call petechiation. They can bleed from the nose. They can have some edema, muscle weakness, loss of coordination. Like those are all things that can happen in this like cyclic phase. But again, that can look like a lot of other things.
And again, it can be extremely minor. It can be really, really obvious. It can be really subtle. And so again, if you've got one of these horses that just didn't get a lot of virus, it's very easy to miss this.
Yeah.
It's extremely easy to miss this, or it's extremely easy to kind of chalk it up to something else. And because it is cyclical in nature, we throw some anti-inflammatories at it, some Banamine, bring the fever down. If it goes down, we may just be like, oh, he had a cold or whatever. If it's a traveling horse and they're around other horses, we're like, oh, he just, picked up some shipping fever, no big deal.
Yeah.
And we just kind of go on. And
I think it's hard too because the intervals between these cyclic episodes can be, they can be a few days, which makes it easier to kind of put 2 and 2 together, but they can be up to months between these episodes. And so that makes it really difficult to keep track of and notice patterns sometimes. So it is really hard to pick it up, but once these horses are infected, they are lifelong carriers of this disease. So they will never get rid of it. They will always be what we call a reservoir for the disease. So if another fly comes and bites this horse, they can pick up that virus, even though that horse isn't showing clinical signs, and spread it to the next one. So that's very important to note that they never, ever clear the virus. It's always there. And so they're definitely lifelong carriers.
And there's no treatment for it. There's no vaccine that we can give that prevents this. So if you're on the internet and you see somebody advertising some protection for it, there is not. That's at least none that we know about.
No.
I'm sure if there's something that comes out, you guys will be the first to know, but
yeah, there's nothing. Not every horse that gets it is going to die. A lot of them will just be, kind of low grade in this cyclic thing for a year, and then they'll again be lifelong carriers. Some of them do have what we call a peracute presentation, which is very sudden onset and very high viral load, very bad infection, which can lead to an extremely high fever, epistaxis from the nose, and death, which is not super common, but it does happen. But that's just not the most common presentation of the disease.
And then in these horses that do go on, if they do survive that kind of initial phase, they can look completely normal for the rest of their lives. Or they could, they've said that these horses that are persistently infected, they will show flaring throughout their life, especially, if they get sick with something else, if they have a stressful encounter with something, that they will kind of show this. And they do say that that kind of permanent shedding, it does go up when they are actively showing these signs, and then it kind of cools down. But the bottom line is that they are still carriers.
Yeah. I read too that they have the most viral shedding when they are febrile too. So whenever they
Yes.
have the fever, that's when everything is kind of at its height for transmission. So but yeah, that's kind of, what it is and what it can look like. But like we said, you can't confirm the diagnosis based on just clinical signs because there's a whole list. It can look like, other diseases like purpura hemorrhagica. It can look like paraplasmosis or leptospirosis, severe parasite infestations
Yeah.
of the GI tract or the liver. Some toxicities can look like this, immune-mediated disease like hemolytic anemia. Like, these are all things that these clinical signs fit right in with. And so it's not something that we can just look at it and say, oh, yeah, that's equine infectious anemia.
Correct.
So then I guess going into how do we find it? It's just where we bring up our lovely Coggins test.
The Coggins test. So this is an agar gel immunodiffusion test or diffusion test. It stands for AGID. That is our gold standard for testing.
Yep.
So this test was developed by Dr. Coggins in 1972. And this was actually kind of a response to this, kind of disease that we were seeing, and it was killing horses everywhere. And they said, hey, how can we, how can we track this? Like, what can we do? So they came up with this test. And in the 1970s, it was about 4% prevalent across the United States, which, that's pretty decent, like, percentage.
Yeah.
In horses, and
especially for something that we don't have any treatment for.
Exactly.
Yeah.
And so in 30 years of testing horses, they dropped it to less than 0.1%. And in this past, year that we got data in 2023, I think they said it was 0.004% of horses that they tested across the United States.
Nice.
So, just doing testing and identifying these, kind of at-risk populations and all of that, they were able to, really drop this because unfortunately this is a very devastating disease.
It is.
And because if you do have one of these chronic horses, there are really two options that you have. You either are mandated to euthanize the horse, or you have to keep that horse permanently isolated for the rest of its life, and it has to be at least 200 yards away from any other horses.
Yeah, and oftentimes they'll tell you have to put them in like a mesh stall.
Yes.
And the mesh is so that those biting insects can't get to that horse. And that's just it's really not a life for a horse. There's quality of life there is poor. So, and it's not a disease that, sometimes will keep horses alive for, breeding purposes and things like that. But even in this one, semen can be contaminated with the virus, and so you can't even breed them or do anything like that.
And it can spread in utero as well, so it can spread from a pregnant mare to the fetus. So, and they've been suggesting too that donating an embryo to a recipient mare, that there could be a risk of transmission in that as well. Yes.
Dang, I didn't know that. Yeah, so it's just not, those are really your two options, is euthanasia or lifelong quarantine with minimal quality of life there. But yeah, so your Coggins test is your AGID, your gold standard. When we talk about a rush Coggins, when we get in those situations where, you are going to be traveling in a few days and you need that negative Coggins test, we can run something called an ELISA, which is the alternative. It's got a faster turnaround. It's an easier test to run. But you can get false negatives on that one. You can get false positives on that one. So anytime we run an ELISA and we get a positive, it has to be confirmed with an AGID. And so the ELISAs are getting better, but they're still definitely not the gold standard.
They're not the gold standard, yeah, but it's still an option. So, and then we can kind of get into, requirements. And so this is, I'd say, the kind of one thing that's mandatory for all horses across every single state in the United States.
And the country.
And yes. So, if you plan on traveling anywhere, if you plan on coming into the United States or Canada or going in between states, if you plan on, using any sort of public showgrounds or going to a campsite,
even
like a trail
within your state.
Yes.
Yeah.
If you, livestock auctions, you have to have a Coggins. It's mandated by the USDA that they're kind of the, overseers of all of this. And again, every state kind of has their own specific rules for it. And the test must be pulled by a veterinarian that's been accredited by the USDA. So we have to go through a specific training on how to do this. The test itself can only be run by, labs that also have this accreditation status. So it's very much a kind of government regulated thing.
Yeah. And like I said earlier, that's why we are so adamant about it and why the state is so adamant about it, because we are responsible for keeping it contained and keeping it, really we're testing for disease surveillance is what we're doing. We're trying to test all the horses so that we can make sure everybody's negative and keep this thing at bay. And we want to keep it at that, 0.004%.
Yes. Yes.
So, we want to keep it contained. We don't want to have these outbreaks because they're devastating. When you do have a positive, the state vet will come in and they will retest every horse on that premises. They'll have an epidemiologist come in and trace that back to figure out where that first positive came from, or like where patient 0 was. And then pretty much every horse that is a positive or has been exposed gets recommended to be euthanized.
Yes.
And so it can be millions of dollars lost in a very short amount of time with these horses, and it can be devastating for the industry. So,
and we're kind of watching it happen in real time now with what's going on in Texas. Like, I don't want to say too much with all that because I know it's a very sensitive kind of topic, but you can see all of the reports and they've done on it. And I mean, the investigative work that went into kind of tracking these horses down and finding them it's really impressive. Like, where they kind of think they found the original horse and then they were able to see all these other horses that have come up with positives and kind of finding, where they've been and who they've been in contact with and all that. I mean, it's really impressive detective work that they've been able to do. And, I think, how quickly they were able to figure it out and, kind of the collaboration with that.
absolutely.
It is really impressive. And, just being able to find all of these horses. Because again, going back to it, a lot of these horses never even showed signs that they were infected to begin with.
Yeah.
Like, it's because again, if it depends on how much virus you get, and all horses are a little different in how they're going to respond to it. So
yeah, there's a lot of variation in how it presents and how everybody responds to it. But the test is very easy. It's one blood draw. We send it off to the lab. They do the things. And it's important to note though that the Coggins test only tests for equine infectious anemia.
Yeah.
We are not, when we're pulling Coggins, we're not testing for other things. We're not testing, for Cushing's disease. We're not testing, your chemistry or your CBC panel. Those are separate blood draws that we have to do. The Coggins is in and of itself just for equine infectious anemia.
I've had people ask me if it's going to tell them what breed their horse is, if it's going to tell them how old their horse is. I said, no,
just EIA.
All that comes from the actual paperwork that we do with it.
Right.
So, when we write the Coggins, we have to get all of the information on the horse. So we take pictures of them. We mark down any of their markings. So, their head, their whirls, any like socks and stars
Any
and
brands,
brands,
microchips. Every Coggins has to be tied to that specific horse and that specific horse only. So this is why the state gets so picky and showgrounds get so picky. If your photos don't look like the horse that you have on the trailer, they're probably not going to let you in.
Yeah.
And for good reason, because we've got to make sure it matches.
Correct. And, in sales too, I've seen a lot too, where people go home from the auction with a horse and a Coggins, and then you look at them when you bring them home and, well, that horse here has a sock and the one on the picture doesn't have a sock. So, something happened.
Yeah. And it's important. We can be a little bit sticklers about, getting good photos and getting good information and having all of that ready for your veterinarian when they come out to pull the Coggins is super helpful. Like,
yes,
know the age of the horse, know the breed, know, if they have a registered name, if they don't have a registered name, just have all of that information ready and available for your vet when they get there. Makes our lives a lot easier.
And the test is good for 12 months. So from the date that it's received by the lab and they get the negative result, it's good for 12 months. And so we just have to, re-pull it every 12 months. The issue with that comes is that, again, even if you get a negative result,
you could be exposed the next day and
or
get infected the next day.
Or you could have been exposed, a couple days before that, and it just hasn't shown up yet.
You're in
So
that 10 to 14 day window. So it's not perfect. But again, it's the point of it is disease surveillance and just making sure that we are trying. If we're testing regularly, then we can find these more regularly and stop them before we have a big outbreak. So that's the whole point of the yearly testing.
I mean, it's kind of reminds me of like the COVID testing and
Yeah.
like all of that. Again, I'm like, I could walk out of this building and get infected with COVID, even though I just got a negative swab. But again, the idea is there. It's picking out the affected population and doing something about it. And I've heard a lot of people that get upset and they're like, well, I just think it's a thing from the government and they're just trying to get our money and regulate stuff. I'm like, yes, but this is
There's
a
reason.
this is extremely devastating.
Yeah.
And again, I mean, even in the 70s when we started this, 4% is huge.
A lot of horses.
That's a lot of horses. And that's just the horses we're testing.
Yeah.
There's a lot of horses out there that they've never had a Coggins on them.
And that's why I say, like, yes, you are required to have a Coggins if you're moving in, if you're going to a show, if you're moving state lines, if you're, moving the horse at all. But even, your backyard guys that don't ever go anywhere, they should also have a Coggins, because the thing is 200 yards is not a very long distance. And so, your horses in your yard that never move, okay, well, you've got your neighbors 150 yards down the street that their horses are traveling and showing all the time. Those biting insects are going to fly between your farm and their farm, and they can bite those horses. And so even though, your horses might not go anywhere and they might not show anymore or anything, it's still important to pull a Coggins on them once a year.
Plus, you never know what happens to them.
Gosh, yeah.
You never know if all of a sudden you have to up and move overnight, and
like if there's a hurricane or something and you've got to evacuate your horses and you don't have a negative Coggins, that's a requirement to move horses across state lines.
Exactly.
So, and it's not an expensive test. Like, I know some of our diagnostics can get pretty pricey as far as blood tests go, but Coggins is not one of those. I think we charge $50 for it.
In the realm of horse expenses, I think it's probably one of the cheapest things.
It is, and it's easy. It's like I said, it's one stick. It's 3 mils of blood. It's not a difficult one to get. So
no,
definitely would stress testing everybody once a year, whether they move or not.
Yes, absolutely.
But again, like we said, there's no treatment, there's no vaccine. If you get a positive, that state vet's gonna get involved. And it's not just, one positive, we've got to put the horse down. There's several steps in between to confirm that this is truly a positive. They'll retest that horse several times. They will retest all the other horses in the property, and then they will make recommendations from there.
And I believe there's even just certain regulations too with the USDA, if you have a registered boarding facility or something like that, you have to have a Coggins. Is that I'm seeing nodding from behind the camera, so I believe that's true. So
yeah,
even all licensed places, they have to have, everybody has to have a Coggins bare minimum on that in order to be registered. So that's even something for if you are a barn manager or, you have a facility or something, like that is something that's your responsibility now. If you have horses on your property, they have to have a negative Coggins.
Yeah.
So.
Yeah. Yeah. And it doesn't matter what state you're in. That's going to be the bare minimum.
Bare minimum. And so I think, kind of wrapping it up, is this something that I think everybody needs to be afraid of? Like, do we need to be sounding the alarm for, equine infectious anemia across?
I don't think so, but I think, it's definitely something to be aware of. I don't think we necessarily need to fear it, but that's because we have good disease surveillance. If we didn't test as heavily as we do and we weren't, as on top of it, I think it is very scary for sure. But as long as we stay on top of our testing and disease surveillance, I think, it's definitely something to have in your mind. but just be smart about it. And there are ways to cut down on your exposure risk and prevention and things like that. So we can talk about it. But I mean, I kind of live in fear of it, to be honest. But that's because when you're in school, it's very scary. But I think, as long as we're smart about our testing and our disease surveillance, I think we can carry on about our lives.
Yeah.
Yeah.
Absolutely. And again, it's practicing good hygiene too with, not reusing needles or syringes. If your horse ever needs a blood transfusion, they have tests on it, to make sure that these horses are negative when they're donating and that the blood is also negative, and just be practicing good hygiene with that.
Yeah. Yeah. And like we talked about, no reusing needles, no reusing IV bags, and for different horses, like that is a big no-no. And even for us, like equipment that's shared between horses for dental procedures or, castrations, things like that, like those need to be disinfected between horses. If there's any blood contamination whatsoever. And so, that falls on us as well to practice good, medicine and control that iatrogenic transmission. But controlling insects and using repellents and things like that can help as well. Just keep those flies off of your horses in the first place. And the big thing is, like we talked about earlier, the virus can be inactivated by bleach and compounds like that. But bleach, if there's any organic debris like dirt or manure or things like that, that bleach doesn't work. So you have to remove all of that organic debris first with good old-fashioned soap and water, and then you can use your bleach or your alcohol to kill that virus. And so just using good cleaning practices and trying to keep everything as clean as possible. I read something that they say not to do pressure washing. Really? For that organic debris, because they said that there's a risk of aerosolizing the blood particles and that could lead to transmission. And I'm like, that I think is interesting.
Who's running these tests?
I don't know. I'm like, who has time to do all that? But anyway, so just something to think about.
Okay, interesting.
Yeah.
Sure.
Yeah. But they did say, they have shown that it can be aerosolized from the respiratory tract if there's some epistaxis or nosebleed. So, but yeah, it's a very interesting disease, and I think the epidemiology behind it that they do is just, it's so impressive. Like
It's so cool. Like again, like, just kind of watching this unfold, I was like, man, like the detective work that goes into this and tracking it down and everything is just like, I was so impressed, like just kind of learning about it.
And they just, like you said, they did it fast too.
Yes.
They really cracked down and they found it really quickly, which was awesome. Because the longer it goes undiagnosed, the more horses that are exposed. So, but yeah, it can definitely be scary. And with all the outbreaks out there, kind of just wanted to talk about it and shed some light on it and let everybody know that, it is definitely a concern, but, as long as we're responsible with our movement of horses and testing of horses and all of those things, we can continue to kind of keep it under wraps.
Yeah.
So
cool.
Well, cool.
Cool episode.
I think it was a good one. So I hope you all enjoyed it. If you guys have any more questions, please don't hesitate to reach out and let us know. We are on all of the social media platforms. You can email us, you can call in, you can write me another letter. That'd be great. But yeah, thank y'all for tuning in.
Thanks, you guys.